Hey, Dr. Drake here. When most people hear the phrase prenatal stress, they usually think of emotional stress. They think of worry, like overwhelm, anxiety, or maybe fear around labor and delivery. And yes, those absolutely matter. But the truth is, prenatal stress is much bigger than just emotions. During pregnancy, stress can show up in several different ways, and that is important to understand because a mom's body is not just growing a baby. It is also adapting neurologically, physically, hormonally, and metabolically every single day. So when we talk about prenatal stress, we have to look at the full picture because mom and baby are hardwired together. First, there is emotional stress. That may come from previous loss, fertility struggles, fear during pregnancy, uncertainty around labor, or even just the constant question of, is everything okay? Pregnancy can be beautiful, but it can also feel vulnerable. And when a mom is carrying fear or uncertainty for weeks or months at a time, that has an impact and an effect on the nervous system. Then there's physical stress, and this is a huge one. It often gets overlooked too. Things like poor sleep, changing posture, pelvic tension, low back discomfort, round ligament tension, digestive challenges, fatigue, the constant physical demand of a body rapidly changing and adapting. Even if a mom is doing fine, her system may still be working overtime just to keep up with the load of pregnancy. Okay, and there's also chemical stress. That can include inflammation, blood sugar stress, poor nutrition, toxins, medications, vaccinations, illness, or just the internal biochemical demands that naturally increase during pregnancy. The body has to process all of that while still trying to regulate and support both mom and baby well. And then there's neurological stress. This is the piece that often gets regularly missed. Neurological stress is really about how well the nervous system is adapting to everything else. Because stress is not just what is happening around you, it is about how your body is processing and responding to it. One mom may have a very full, demanding pregnancy and still stay relatively regulated. Another may have what looks like a normal pregnancy on paper, but her nervous system is stuck in a constant stress response. That matters because the nervous system is the system controlling everything else. It is helping regulate sleep, digestion, muscle tone, immune function, hormone function, balance, circulation, and stress responses. During pregnancy, it is also helping create the internal environment baby develops in. So when stress becomes ongoing, whether it's emotional, physical, chemical, or neurological, the body can start to shift into a more protective state. This is what we often call fight or flight. In more technical terms, the nervous system starts leaning more heavily on the sympathetic branch, like the gas pedal is staying pressed down. And when that happens, the body has less access to the parasympathetic side. That's the calm, restorative side that helps with rest, digestion, regulation, healing, and healthy adaptation. God, that word. This is why a stressed nervous system during pregnancy can show up as a poor sleep, more tension, more overwhelm, more discomfort, more digestive struggles, and an overall sense that the body just is not handling the load as well as it should. And again, this matters not just for mom, but for that baby too. Because pregnancy is a time of constant communication between mom and baby. The environment baby is developing in matters. So when we support mom's regulation, we are not just helping her feel better in the moment, we are also helping support a healthier foundation for baby from the very beginning. That is why in our office, we do not want to just guess at stress. We want to measure it. That's where insight scans come in. Our scans help us look deeper into how stress is showing up in the nervous system during pregnancy. Instead of only focusing on symptoms or where mom feels discomfort, we want to understand how her body is actually adapting. The first scan is heart rate variability, or HRV. This tells us a lot about stress adaptability. It helps us see how well the autonomic nervous system is balancing between stress and regulation. In simple terms, HRV gives us a picture of how flexible and adaptable the body is. If the system is stuck in stress mode, that usually shows up here. The second scan is EMG, which looks at muscle activity and tension patterns. So muscle activity and tension patterns. This helps us see where stress is building physically in the body, especially along the spine, the surrounding muscles. During pregnancy, that can be especially helpful because so many moms are carrying tension patterns that affect comfort, posture, pelvic balance, and how easily their body is adapting to change. The third scan is thermal. This scan helps us look at how the nervous system is regulating and communicating, especially when it comes to stress patterns and imbalance within the autonomic nervous system. It gives us information about how well the body is staying balanced versus stuck in stress physiology. And that is what is so powerful about these scans. Each one gives us a different piece of the puzzle. One shows adaptability, one shows tension, and one shows regulation and balance. So rather than making assumptions based on symptoms, we get a much clearer picture of what stress actually looks like in that pregnant mom's nervous system. And from there, we build a personalized care plan. That part is really important because no two pregnancies are exactly alike. Two moms may have low back pain, but underlying stress patterns in their nervous system may look completely different. One mom may need support around tension and sympathetic dominance. Another, she may need help with chronic exhaustion and poor adaptability. Another may be dealing with a blend of physical stress, emotional overwhelm, and regulation challenges. That is why we do not believe prenatal care should be a one-size-fits-all. We got to look at it. We use scans along with your history, your story, and what your body is showing us to build a care plan that is specific to you. The goal is not just temporary relief. We want to grow well babies. The goal is to reduce stress patterns, improve brain-body communication, support better nervous system regulation, and help your body adapt more effectively throughout pregnancy. When we do that, moms, you notice that they are sleeping better. You're feeling less tense, handling stress better, digesting better, and feeling more comfortable overall in your body. And that's great. So yes, pregnancy stress is real, but it is not just emotional. It can be physical, chemical, and neurological too. And if we really want to care for moms well during pregnancy, we have to look deeper than symptoms alone. That is why we take a nervous system first approach in our office, because we understand how stress is showing up in the nervous system. We can create more specific, more personalized care that support both mom and baby in a much more meaningful way.